because COVID will allow us to meet remotely. So I need a motion.
So
Phil?
move.
Mr. Fennell? All those in favor?
Aye.
Aye. Any nays? Okay. Okay. Even for the approval of the minutes? Okay. So first order of business is the approval of the minutes from the June 24th, 2020. I need a motion to get that on the floor. Linda, second. Brandy. Any questions, comments, changes, additions? Okay, since she's here, do we have to do a roll call? Okay, all right.
All right.
So we'll have to do a roll call on the approval of the minutes.
All right. So I can go ahead and call the roll, Madam Chair. Chairwoman Williams, how do you vote on approval of the minutes? Vice Chairman Fennell,
Aye.
Ms. Groves Allison,
Aye.
Ms. Bryant,
Aye.
Ms. Daly,
Aye.
Ms. Duncan,
Aye.
Ms. Relaford,
Aye.
Mr. Renault,
Aye.
Mr. Ricker,
Aye.
and Mr. Salzer.
Aye.
Motion carries unanimously, Madam Chair.
Thank you. So we'll move on to informational items. Our first report will be from Monica with the Board of Health. Welcome, Monica.
Hopefully, is it on? Yeah. So in your packet, you have our most recent Board of Health minutes, along with any additional questions that you might have related to COVID, and I can also provide a quick update on where we sit in terms of our response as an agency. I think last time this committee met, we were just over 500 total cases. In our county alone, we are now sitting at, make sure I have the right data point up for you. 3,312 cases for Peoria County. Majority of those are considered recovered. 11% of our cases are at home and isolating. About 1% are currently hospitalized in our area. We are starting to transition more since the last time this committee met. We have now onboarded 9 additional contact tracers, along with 3 outreach workers, as well as a social worker. All this is related to the COVID tracking grant. We continue to also hire additional support staff for that position, as well as, again, more contact tracers. The CDC recommends approximately 30 contact tracers per 100,000 population, recognizing the fact that we don't expect our entire population to be positive or in some form of the isolation process at a given time, but that is what they do recommend that we have.
Are there any questions for Monica? No? Are there any questions for those that are on the phone?
No. No.
Ms. Bryant, sure.
Yes, go ahead.
Monica, I just had a question about the return to school with the students. Have you noticed or seen I'm just asking how that's going with the COVID or any cases or anything like that?
So when school began a few weeks ago, I think we're now in week 6 of school starting that we're in person. We did see an initial push of cases. A lot of this had to do with carryover of exposures that happened during the summer based on travel or large gatherings. Once school has settled in, that has significantly dropped. We're still seeing cases come forward. Our schools are well trained and responding rather quickly. One of the things that we instigated early is we developed a specific email address just for school administration to utilize, so that it was always responded to 24/7, because we actually do in Peoria County have a contact tracer or an investigator working even in the weekends. So there was always a response turnaround time. Likewise, as I mentioned, that has simmered down considerably. The most recent increase we've seen, especially with the 18 to 19-year-olds, actually is more, I would say, from the 18 to 22-year-olds, and that's been related to Bradley and more college-age students. But for our 0 to 9, which would be primary school, so think kindergarten to 4th grade, only about 4% of our cases that we average are in that age range. And the schools have done a great job in controlling it, as well as identifying close contacts rather quickly. So we're able to respond in partnership. So by the time we make the call, parents are already been notified and they're expecting to have that conversation with us. So again, our school districts have gone above and beyond during this response.
Any other questions? No? Okay. Is there any care and treatment board report?
No update.
Okay, thank you. So moving on, we're at sustainability and resource conservation. Karen? Hi, over there.
Hi, good afternoon. I decided to sit over here today, if that's all right. So, Rob, I'm in your spot. We had a report in your packet, and the most important thing that I really am excited about, the first thing is our household hazardous waste events. This is something that Illinois EPA came out in the past month to determine that they wanted to have something a little more on the calendar from year to year. So Peoria County, along with 4 of other communities that are downstate, have been selected to have a household hazardous waste event annually. So this is something that we're real excited about, especially since we did have one last year, but the one before that was in 2012, 2008, 2005. So it's something that we're able to bring to our community, at least for the near future, depending on state revenues. So we are excited about that, and something that we can also prepare for our residents to participate in, not only in the near future, next year, but also we can say, hey, we'll be here again next year. You won't have to wait 3 to 5 years to have another event. So we're definitely excited about that, and it's something that we can gear up earlier than usual, and we can take advantage of people to get rid of their chemicals and stuff out of their basements and their garages. So happy to say that May 15th, 2021 will be our first event out of this, so we're excited. And I'll probably be coming to anybody who wants to volunteer for a couple hours that day. We certainly appreciate all the help, and all it is just directing traffic. IEPA has a vendor, and they handle all of the materials, so no hard work needed. So that's one thing. If you have any questions on that, I can certainly answer that. Absolutely. We're going to start working on advertising and letting the public know, because one of the things that worked out really well that we did last year, along with a lot of my counterparts, is people signing up for it and scheduling an appointment. This helped out tremendously, and it helps out with the participants. They don't have to hurry up and get in line at 7:30. They don't have to wait. There's 15-minute increments. They come at their allotted time frame. So the waiting is, a big part. It alleviates a lot of the traffic. It also helps our vendor to fully staff to make sure that the number of people that have signed up for it, they have enough people to handle it.
I'm just thinking the earlier we can market it, the less likely folks are going to be illegally disposing of the chemicals.
Exactly.
If they know this event is coming, they can put them aside in their
Exactly.
garage or wherever it may be.
Right.
And know that they can set them aside until then.
Right, and maybe we will do a earlier push before we start the appointment schedule. Maybe we can just put out something saying, details coming soon. Look for this event, and we can do that as well. Earlier, maybe around November. So how about that? Okay. Otherwise, I'll continue on our sustainability update. Chairman Williams asked if I give just a little bit more information for this meeting. Our sustainability team, which is comprised of mostly our facilities staff around all of our county buildings. However, we do bring in experts in other departments, such as highway. We have planning and zoning, so they can help with some of the land use issues, fleet, as well as a number of other people that we may specifically target, such as also IT, some of our processes and some of the opportunities for employees. So just want to let you know that that's what we've tried to bring into putting together our sustainability plan that was adopted back in 2011, putting forth opportunities to catalog all of our programs, initiatives, upgrades, efficiencies, so that we can have them all documented into one plan, so that we can show it's all in one place. But from since 2011 to 2015, we did a update, and again, we plan on doing that this year as we go through each of the 6 elements of the plan. Those 6 elements being buildings and construction. We look at the operations, which includes our HVAC, utilities, water usage, land use, how we take care of our properties, including vegetation, native plantings, reduced mowing, purchasing. Jim Smith helps with that. Employees, this is something that certainly cannot be successful without everyone's help. And one of the things that Becca does for employees is for all of the new employee orientation. She goes and gives a little overview of how employees can participate in recycling programs and how they can be a part of making this a successful plan, and then also our solid waste efforts. So we have something that we just try to keep it updated and current. If there's some new initiatives coming forward, like we have a lot of LED lighting going in now, so that's something we want to capture and put into our plan. So as we go through some of those, each of those sections is what we're going through every other month. The sustainability team gets together, trying to capture some of those things. So I'm certainly more than happy, especially if our newer members would like to see the plan. We do have that available if you want to have any comments or any feedback. I'm certainly happy to do that as well.
Is it available for the general public to see? Is it on our website?
I believe it is. I will have to double check to make sure. Certainly with especially our progress reports as well.
Okay,
That gives specific projects that we've done.
great. Okay. Is there anything else you want to add regarding your report?
I'm sorry.
Is there anything else you want to add regarding your report?
Nope. That's all I have for now.
Okay, we appreciate it. Okay, we'll move on to Headington Oaks. Paul, hi, welcome.
In your packet is the financials for Headington for July 2020, and I'll be happy to answer any questions you might have.
Are there any questions? Are there any questions from the members on the phone?
No.
Oh, okay, no one on the phone. Linda?
Can you explain to me the difference in the accounts receivable between, let's say, Meridian and Molina? I make the assumption they're both HMOs for Medicaid.
Right, they're both managed care providers for Medicaid.
Right. But there's a stark difference.
So we've had some, and this is one of the things we're going through with account cleanup. Meridian, it appears that they double paid on some of the residents, and we alerted them to that, but they continued to double pay. But we're going through and looking at those line items and making sure that wasn't overpayment on their part. Molina has what we kind of refer to as a slow pay process. As we've documented in the past, it can take 6 to 9 months to get approved for Medicaid. And with Molina, anything that you bill them that is over 6 months old, which a lot of the original billings are that, they will deny it every time when you first bill it. So they deny it, and then you have to appeal it and rebill it. So that drags out the payment from Molina quite a ways, as you know, it could take us 6 to 9 months to get that approval. Then you put the first billing through, then they're going to deny it, then you have to appeal it and rebill it, and it really stretches that cycle out as far as Molina goes.
Have you or whoever is doing this used the medical provider complaint portal?
I do not know that. As I don't do the actual billing,
Right.
I'd have to check on that and see for
Okay.
you.
Because if not, I have a link to that.
Okay.
And this is what Healthcare and Family Services says is the appropriate way if you're filing a claim, because now you've got the application approved, so you have a claim to file so that the county can receive benefits. And then if they're doing things like this, I believe that you'll get some results by going through that complaint portal.
Okay, I'll check on that, and if not, I'll get the
then I
link
want
from
to
you.
know about that too, because that's what HFS tells me every day.
Okay.
So, yeah, I just couldn't understand how everybody else owes us, but we owe Meridian.
Right.
Thank you.
Any other questions? Okay, moving on. We are at resolutions. The Headington Oaks collection policy. Who's going to take this one? Paul or Shauna? I'm sorry. Oh, yes, sorry, thank you. Mr. Fennell is second. Jennifer? Sorry about that.
Okay, this is, I'll just give a quick overview, and then if there's any questions, we can kind of walk through each of your questions. Back in, I believe it was May 2018, the board approved the bad debt policy as part of the financial policies of the county, and that was the process that you wanted staff to take when it was determined that it was something that was uncollectible and then therefore a bad debt. So this policy is intended to supplement that and basically establish your policy and procedures for the process leading up to doing the bad debt policy. So as you've seen in Paul's monthly reports, there's really 4 different types of collectibles that we have within Headington Oaks. The first would be Medicaid, Medicare, private pay, and then some of our vendors. For example, hospice. We pay for the hospice patients' billing, and then hospice reimburses us. That's just the way that we're required to do that under the law. So there's some of those vendors that then owe us money instead of it being through accounts payable. So having said that, well, I do want to say apparently I can't count. I went policy 1, 2, 4, and 5, so I will collect that before it gets to the board. My apologies on that. But basically what we did was we just established a series of objectives to make sure that we're collecting everything that we possibly can. I believe there's currently a number that we are aware of we probably won't be able to collect, but we are going to do our due diligence to make sure that we are doing that, and this outlines that process for us. So the first that we established was with private pay, in which we would continue obviously to send monthly statements and past due notifications and review those accounts based upon the size of the balance and the age of the account. And then we would work with the state's attorney's office to determine which, after approximately 60 days, which of those accounts we needed to send into a formalized collections process, just like you would with any other standard medical type billing. And we would work with the state's attorney's office on that. Policy 2 is the Medicaid and Medicaid pending. We continue to work for those that maybe were in pending status at the time that they relocated to another individual. Another facility. I know one of the 2 that we had to secure state guardianship for was still in pending status, so we're working to make sure that we get that wrapped up. But continue to monitor those cases, and then also take a look at, and talking with Jenny and her team, taking a look at If we are aware that a resident recently deceased and they have an outstanding balance, being able to go in to look to see if there is an estate open, and then make sure that we're part of that estate filing to recoup those monies at that appropriate time. And then policy number 3, not number 4, Medicare, again, similar to the Medicaid, Medicaid pending, we continue to monitor the invoices, research the balances. If it's found that it should have been paid, we can write that off through the Medicaid cost report structure that we already have in place. And then if it does not, then we can write that off in accordance with the bad debt policy if it's determined that that's not collectible. And then finally, policy 4, not 5, the vendors, which we would continue to send the monthly statements and past due notifications to some of the private insurance companies and also some of those hospice firms. And then contact them to collect those balances. And again, similar to the individuals, at that point, then we would work with the state's attorney's office to turn them over to some form of collections agency. Happy to answer any questions you might have.
Are there any questions?
I have a question.
I'm sorry, go ahead.
My question is, I thought Shauna said that there's a certain amount that she doesn't anticipate us collecting on. Does she know about how much and why we wouldn't be able to collect?
And Paul, correct me if I'm wrong, but we currently have $3 million on the books as an allowance. We currently have $3 million as the allowance, so it would be anything above, anything within that difference, right? Yeah, the $3 million is of the 5.5 is what we're anticipating we won't be able to collect, basically. But we're going to do everything we can to get that. But right now, that's what we have booked.
Rob, any follow-up questions?
I think I heard the amount, but what were the reasons why we wouldn't be able to collect on some of that?
Some of that, and I'll ask Paul to jump in here too, because he's way more versed in this than I am. Some of that would obviously be if it's an account where the resident passed away a couple of years ago and we're still trying to collect and we can't, and that estate either can't be opened or has already been closed. I mean, that's a very basic example of where we would not be able to collect that. I'm assuming some with Medicaid and Medicare, the billing.
Yeah, there's some very old accounts that are still on there if we concentrated on the current population or recently first trying to clean that up when we were operating. So there's some very old accounts that through various specific, whether it was Medicaid, paperwork wasn't filed, things like that, there'll be accounts that we won't be able to most likely to get.
Could Rob hear that? I can repeat that if not.
Yeah,
Okay.
could you repeat that? for-
Rob, Paul said, I'm sorry, we'll have to have him come up here. Paul said that we do have a number of very old accounts that we just know that we won't be able to collect on, whether it be the proper paperwork wasn't filed at that time, maybe that resident is now deceased, and so on and so forth. So there's a number of older accounts that we just know we won't be able to collect on. So we've been focusing on the newer ones so that we make sure that we do not end up with growing that list of old accounts. So we've definitely altered our strategy there.
Rob, any?
Okay.
Okay. Linda,
Oh, Sharon.
hold on just a
Sharon,
second.
this is Betty. This is Betty.
Okay, go ahead, Betty.
Where she mentioned policy 3, she said policy 3 Medicare. I see a policy 4 is. Am I incorrect to read that or what?
They were misnumbered.
It's misnumbered.
It's misnumbered.
Misnumbered.
Yeah.
So it goes from 2,
1,
3,
2,
and
3,
4.
and 4, yes. Vendors is 4,
Oh,
Medicare
okay.
is 3.
Okay.
Okay,
All right.
okay. Linda, go ahead.
I guess I just have a question in terms of the uncollected debt. I remember at this committee having a discussion, and I don't remember the precise month. It would have been maybe November, December, January, anyway, about a particular situation where the person passed away, and we had a discussion about having an attorney file against the estate because it became clear that the family was not going to provide any more financials to qualify this person for all the time they'd spent at Huntington Oaks. So I guess my question is, have we ever pursued anyone's estate to date to collect these bad debts?
Not that I am aware of, and I don't know, Paul. I know not in the time that Paul and I have been here, we have not, which is one reason why we wanted to make sure that we ended up with that written into the policy so that we can proceed with that.
Because that is, I mean, I don't know. If people know they have too many assets and they are unwilling to say that, and then the person becomes deceased, they owe for the time that person lived there. It's fraud. They knew they could pay. So I certainly hope we're going to look into those instances.
Absolutely.
Okay. Any other questions? Mr. Ricker, do you have any questions?
No, I don't. I heard most of Linda's, and I agree with Linda. We need to do everything possible to look into, some of those residents that, we need to follow up. I'll just kind of leave it at that. I think the policy overall looks good. I'll support the policy. I just want to make sure that we do our due diligence, which I think the policy outlines adequately. That's all. Thanks.
Thank you, Steve. Any other comments, questions? Okay, we'll have to do a vote.
Roll call vote. All right. Chairwoman Williams.
Yes.
Vice Chairman Fennell.
Aye.
Member Groves Allison. Member Bryant. Member Daly. Member Duncan.
Aye.
Member Relaford.
Aye.
Member Renault.
Aye.
Member Ricker.
Aye.
And Member Salzer.
Aye.
Motion carries unanimously.
Thank you. Moving on to miscellaneous. Do we have any miscellaneous? No miscellaneous? Okay, then we're adjourned. Thank you.